Good afternoon. My name is Maurice Cole. I work at the Cuyahoga County Board of Health in the Community Health Services area. I'm a researcher on the Child and Family Health Services grant and also on the Enhanced Prenatal Services grant, but that one is sadly coming to an end at the end of this calendar year due to just some fiscal and budget constraints within the county. So I'm going to go through some of this information rather quickly. I'd like to keep this very informal, so if you have questions, if there are some topics that you would like to discuss, let me know, or maybe we can save some of those for the end. So first off, to give you a little history of the Cuyahoga County Board of Health, our district Board of Health has been serving cities, villages, and townships of Cuyahoga County since 1919. We do represent Ohio's largest health district by population, and we provide a broad range of quality-driven public health programs and services. Currently, we have been serving around 835,000 residents here in Cuyahoga County, and as of last year, we actually absorbed Lakewood and took on that municipality, providing services to their residents as well, which added an additional 51,000. So we're at about 886,000 people that we are currently serving. It is important to note there are two other health districts that are not a part of the 57 municipalities that we cover, and those are the city of Cleveland and also the city of Shaker Heights. They have their own independent health departments, but we collaborate a lot, especially in the season of H1N1. So I'll talk a little bit more about them later with some other programs. I'd like to offer our mission statement for the Board of Health: to prevent disease and injury, promote positive health outcomes, and provide critical health services to improve the health status of the community. And to talk more specifically about the Community Health Services area, we were founded in January of 1997. Our funding comes from a variety of grants, both at the state level, some federal dollars, general funds, because all of the municipalities pay money into a pot, if you will, that helps to cover the cost of services that we provide to its residents. So we have contract services that assist us with some of that revenue. To talk about a few of the programs that we offer here with the Community Health Services area, I will highlight a few of them. Breast and cervical cancer, cardiovascular health, Child and Family Health Services, Child Fatality Review Board, childhood lead poisoning prevention, community nutrition, dental options, home injury prevention, teen wellness, and tobacco use. So to talk briefly about the breast and cervical cancer program, essentially we are managing 7 counties in Northeast Ohio. It does cover women who are uninsured. Once we make contact with them, if they fit the criteria, income does have a part of that, and also insurance status. Then once the ladies are enrolled in our program, they will qualify for a free mammogram and for a free Pap test. And then if those results come back and there's additional work that needs to be done, then they're enrolled in an insurance program that actually covers the cost of all of those services, which is pretty tremendous. Cardiovascular health, we do focus on, some of the risk factors involved there: tobacco use, nutrition, physical inactivity, cholesterol, high blood pressure, diabetes. There have been some targeted communities that we worked with in East Cleveland, North Randall, and Warrensville Heights, but it is a sort of community-wide, county-wide program. Also, there's been a lot of talk lately in the literature about social determinants of health, and I'm going to actually allude to a YouTube clip that you can check out later about unnatural causes that, again, talks about those social determinants of health. Just listed a few here: influence on individual behavior, things like housing, education, racism, environmental justice, and policy. Child and Family Health Services, something that I've been a part of for the last 4 years. It does have a maternal and child health focus. We're trying to eliminate health disparities, improving birth outcomes, improving health status for women and children in Ohio. There are some sub-grantees that are listed there, folks like University Hospital, Metro Health, Fairview Hospital, the Northeast Ohio Neighborhood Health Center, the Cleveland Regional Perinatal Network, and then we're also collaborating with our friends at the Division of Adolescent Health at Case Western. We do have 2 internal programs, both a public health nurse that can do home screenings with new moms, and also a wellness program that's trying to improve activities in local school districts. Child Fatality Review Board, there's actually a child death report that we put out each year. It does review all deaths from birth up to 17 years of age. There's 2 panels. It's kind of a multidisciplinary approach. They present newsletters, again, that annual report, their safe sleep education, Radio 1 ads, health fairs, etc. Also, I can talk about community nutrition programs, Board of Developmental Disabilities, Bureau for Children with Medical Handicaps. They do also offer public speaking and try and address issues related to childhood obesity. All right, so next up is our Dental Options program. Dental Options manages 14 counties in the Northeast Ohio area. And again, another great example of public health outreach. So it's a limited dental access program for folks who are uninsured. They also need to meet an income requirement. But essentially, and I'll show you the map that shows our area of Northeast Ohio. So someone who qualifies for the Dental Options program can use our provider network to get quality dental care at a reduced cost. So for instance, if with my insurance provider, I go in to get a teeth cleaning and it costs $60, let's say, that's billed to insurance, someone in the Dental Options program might pay $5 for that same service. So again, they're getting quality care at a reduced cost that they can afford. Our home injury prevention program is something that has really focused on our sort of senior population. So I like to offer up the example. Let's imagine that your grandmother is, getting up in age and she really does enjoy living independently, but there are some things that are tougher for her to do around the house. Let's say the cabinets, it's a little harder for her to reach some of those goods that she might have stored. So the home injury prevention program tries to do an examination of the house and then make it safer and easier for seniors to maintain their independence and stay at home. So maybe if grandma's cabinets are at this level, previously, after contact with the program, the cupboards are lowered to this level, which again allows her to maintain her independence and stay there at home. The goal is to help prevent falls because it's clearly something that seniors are at risk for, to encourage senior safety within the home. And there are new monies to make repairs. Some of the targeted communities have included Brooklyn Heights, Garfield Heights, Independence, North Royalton, Parma and Parma Heights, and also Seven Hills. Talking briefly about childhood lead poisoning, some of our lead staff would tell you that we can never make everything completely lead-free, but we would hope to make things more lead-safe. So they do offer lead testing. Their goal is to eliminate childhood lead poisoning. It's also a Healthy People 2010 goal. And this is really a collaborative effort. This is something where we work with the other health districts. You'll see the Cleveland Department of Public Health. Lakewood is covered as that's a part of us now. The city of Shaker Heights, and then also, of course, at the Cuyahoga County Board of Health level. The childhood lead poisoning prevention program is also really interesting because it crosses multiple disciplines. It may be the only program, actually, that I can think of in which the folks in community health work very closely with the folks in environmental health and also in nursing. So there are multiple people from those various disciplines that are a part of this team. Although with H1N1 season, yeah, we have all kind of worked together in that capacity too. So that's been some cross-disciplinary approach to public health of late. Did you get your seasonal flu shot? Do you qualify for H1N1? Something to consider. Teen Wellness Initiative. This has been a program that's been around for a long time. And the best example of it currently, they're serving 7 different school districts and taking this comprehensive approach to sexual health education. So it's really a K-12 program, and the Cleveland Metropolitan School District has been sort of at the forefront of that because this is a curriculum that they use within their district. So it's providing age-appropriate health education information and prevention materials to young people. They also have 2 different approaches, one that's community-based, which is a Plain Talk program that's been sort of widely celebrated across the country as a best practice model, and then also, as I mentioned, the school-based programming being the Responsible Sexual Behavior program in the Cleveland schools. Just a few remaining slides. Tobacco use prevention was funded by the Ohio Department of Health and still is. We used to have more tobacco dollars, but there were some changes at the state government level, and some of those monies were transferred to other places to kind of fill holes in the budget. But we are still able to offer tobacco programming to try and reduce youth exposure to tobacco, and then also to reduce overall exposure to secondhand smoke. Life skills program is what's used in schools for kids in 5th, 6th, and 7th grade, including education on how to refuse alcohol, tobacco, and other drugs, resisting peer pressure, and Operation Storefront, which really speaks to how tobacco is advertised to young people and making sure that that's keeping in accordance with the state law. Smoke-Free Ohio, just have to give a little passing nod. It's nicer to go out to restaurants, bowling alleys, other places and not be all smoked up. That was really a huge public health initiative that we promoted here. We're glad that it passed. There are some folks who aren't quite necessarily following all of those rules, and we do have to issue citations, and then there are actually fines that are levied against those people and those businesses who are not practicing and sort of upholding the law. And then lastly, I will offer up the social determinants of health, unnatural causes. Is inequality making us sick? There's about a 7-minute presentation. I just pulled it off YouTube. I encourage you to do so as well. It really sort of frames the context of public health in the next iteration, talking about how different things in our environment really affect us. So I encourage you to take a look. And if that's actually the end of my thing, if you have any questions, please let me know. I've listed my contact information below. Thank you.